This is important notes. So use a fit tested respirator N95. Always perform a seal check when putting on a disposable respirator. What does the seal check means? You have to press on the metallic strip on both sides over your nose to cover the space between nose, and you cover the mask lightly with both hands. Then breathe in and out, and the air should not leak in or out from the side of the mask. If it is leaking, so it's not fitted well. If it's not leaking, this is fit. So healthcare worker that all available types of N95 are not fit to him, he should avoid it from aerosol generating procedure. Or he can wear a powered air purifying respirator like we can see here in the image. Facial hair like beard, prevent proper respirator fit. Either avoid aerosol generating procedure or use the powered air purifying respirator. Also, place patients in adequately ventilated single rooms. When single rooms are not available, cohort patient suspected of COVID-19 infection together, place patient bed at least 1 meter apart. Avoid the movement and transport of patients out of the room or area unless medically necessary. If transport is required, use a predetermined transport routes to minimize exposure to staff, other patients, and apply medical mask to the patient. Routinely clean and disinfect patient contact surfaces. Limit the number of healthcare workers, family members, and visitors in contact with a patient with suspected COVID-19 infection. Also maintain a record of all persons entering the patient's room, including all staff and visitors, if it's allowed. To summarize, if the person, healthcare worker, collecting specimen for laboratory diagnosis, he should do a hand hygiene. He should also wear gloves, and also he should put N95 respirator, and he should wear a gown, and also should put on goggles or face shield and gloves also. If the suspected, if you are going to deal with suspected or confirmed cases of COVID-19, and there is no aerosol generating procedure, you have to do hand hygiene, you have to wear a long sleeve gown, you should wear a surgical mask, you should wear also goggles or face shield and gloves. If you are doing the aerosol generating procedure to suspected or confirmed cases of COVID-19, you have to do hand hygiene, long sleeve gown, you have to wear a N95 respirator, you have to wear goggle or face shield and gloves also. What does environmental controls mean? So you have to ensure adequate environmental ventilation, adequate environmental cleaning in all areas with healthcare facilities, terminal room cleaning at the time of discharge or transfer of patients, physically separation of at least 1 to 1.5 meter distance should be maintained between each suspected patient and another. How to handle laboratory specimen. So all specimen collected for laboratory investigation should be regarded as potentially infectious. Healthcare workers who collect or transport clinical specimen should adhere rigorously to standard precaution to minimize the possibility of exposure to pathogens. Ensure that all healthcare workers who collect specimen to use appropriate PPE. Ensure that all personnel who transport specimen are trained in a safe handling practices and spill documentation procedure. Place specimen for transport in leak-proof specimen bags. Also ensure that the healthcare facility laboratories adhere to appropriate biosafety practices. Deliver all specimen by hand whenever is possible. Here, this is the these are the reference of my lecture, and thank you.
Thank you very much, Dr. Saad, for your excellent presentation. Sorry, the internet. Thank you, Dr. Saad.
Yeah.
So please, before leaving, so I want all the panelists just to be online and mute your mics. So for some questions. So let's start with you, Dr. Saad.
Mm-hmm.
There is some questions about the transmission now. So about the transmission from pregnant to infant baby,
mm-hmm.
also as well as the transmission from animal to human. Is there any evidence for that? And if there is, how can we prevent?
The transmission of infection from the mother to the infant or to the to her baby through placenta. There is some cases they found it is transmitted, but it's not confirmed yet. And regarding the animal transmission, the Saudi CDC said it's not transmitted through a mosquito. Also, the pets like cats, dogs, they cannot transmit the infection, the COVID-19.
Okay, so this will raise another question, which was asked by Dr. Ashib, that you talk about like the needle sticks, or does the needle sticks will affect or will transmit the virus, the coronavirus, or it's just for the general protection?
It is for the general protection. For the blood specimen, if you take the blood from confirmed patient of COVID-19, there is no reported cases of stick injury, or there is no reported cases of infection through the needle stick injury. So until now, we don't have a confirmation. Can this injury cause transmission of COVID-19 or not? So until now, we don't have any confirmation.
Okay, thank you very much. Dr. Ashraf, if you can just unmute your mics. There is some questions regarding what you present about.